hemorrhagic patients. Come on to cameras. Because it is like speaking me with walls. I want a few of you to interact. Other sessions you are like interactive again and again. Daily I should remind you guys to come on cameras, respond. Take at least half an hour of your time for weekly twice. It is not daily sessions also, right? Right, Arpan? Yes, Johnny? Yes? Daily reminding or wasting my time on come on cameras, respond, it is difficult for us also. You make sure this organization is very much particular on trainings. You will be knowing in future why I am insisting you all these things. Serious disciplinary actions will be taken for those who are not attending sessions, those who are not completing pre-test. Simply to make you fear. I'm not telling all these words. This is true. This organization focus main on like concentrates main on continuous education, so it is a part of our duty. Do not think that why all these sessions we know everything. No. Okay, got it. I will only mark Vinod as present, that's it. Remaining everyone will be absent only, Vinod and Ashok. I'll not keep on telling you to insist or to turn on cameras, respond. This is not my duty, right? Okay. Acknowledge me if my screen is visible. Tell me if my screen is visible.
Yes, ma'am.
Yeah. Today our session is on management of how to manage a patient with hemorrhage. What is hemorrhage, by the way? What is hemorrhage? Yes?
Internal bleeding.
It's not internal bleeding. Okay. Remaining any other answer?
Anticoagulant.
Anticoagulant, internal bleeding. Any other answers?
Ma'am, bleeding.
Bleeding. Okay. As some you are much near to the answer. Hemorrhage means bleeding. Tell me, write it down. Hemorrhage means bleeding. So, as a EMT or as a person who are working in healthcare system should know how to manage a patient with severe bleeding. What happens if a patient is having severe bleeding? What happens? Nothing happens, no? Yes? Or patient will have something?
Pressure will be dropped.
Patient will be?
Pressure will be dropped.
Oh, pressure will be dropped. Okay. Sometimes severe bleeding may leads to hypovolemic shock as well, right? Severe bleeding may leads to death of patient also. So, as an EMT, we should know how to treat a patient with hemorrhage, right? Managing hemorrhagic patients is a critical aspect of emergency medical care, and providing proper training for you guys, that means for all the technicians over here, will help or will help to ensure timely and effective interventions, right? Because as we are working in ambulance services, we will be having many calls that patient had an accident here, there. So once you go there, if patient is having severe bleeding, what you will be doing? Tell me one example. You went to a scene where a patient is having severe bleeding. What you will be doing?
Both IV and anticoagulant cannula. And
Sorry?
15 to 18 gauge. Both IV line and large cannula. And 2-liter bolus.
2-liter bolus, IV cannula. But our main focus should be how to stop bleeding before we shift the patient to hospital, right?
जितना टाइम हमारा ब्लीडिंग कंट्रोल करने में वेस्ट होगा, इससे जितना उसका ब्लड लॉस होगा उससे हम रिकवर कर सके, इसलिए हम आईवी फ्लूइड्स स्टार्ट कर देंगे पेशेंट को.
If we are starting IV bolus, if bleeding is still active, what we need to do? Okay, good Singnia, thank you for your response. I'll be telling you what we need to do. Okay.
Ma'am, sometimes giving patient an extra doctor discuss with him.
Sorry. Yes, Ajay.
Injection, ma'am.
Okay, as prescribed by doctor, if doctor is advising some injections, Azad is telling me that medications we will be giving, right? Yes. So every clear aspect. Yes. Please mute your device when you are answering only. Unmute your devices. Otherwise, keep your devices on mute. There are different types of hemorrhage. Hemorrhage might be due to traumatic, that means any trauma or accident, or some medical conditions leading to bleeding, right? If patient is on coagulations, sometimes patient will be having internal like GI bleeding, right? All these conditions may lead to bleeding. First, initial assessment is very important. It should not, initial assessment means do not waste your time on only assessing the patient. Assessing and implementation is also needed. You have to see the safety and situational awareness. You need to do rapid patient assessment for signs of hemorrhage. That means if patient is having severe bleeding, okay, direct pressure, if patient is having bleeding because of leg fracture, if you see any active bleeding, direct pressure and tourniquet application, that one by one, step by step in video and also explanation I will be giving you, okay. Pressure dressing, and if patient is having wound, packing of wound and direct pressure also can control bleeding. Got it? And tourniquet application. Tourniquet means it is not simple tourniquet what we use for withdrawing blood, or withdrawing blood, or for IV cannulation we use tourniquets, right? I'm not talking about that tourniquets. Do we have a tourniquets for stopping the bleeding? Do we have tourniquets with us? Yes, I want Shijo to answer this question. Do we have tourniquets to pressurize the area of bleeding?
Yes, ma'am. First is we need to apply a tourniquet above the injured area, so that will be help to prevent the
that is
further bleeding.
yeah, I'll be telling that, Shijo. But I'm asking, my question is, do we have tourniquets which are designed for stopping bleeding?
No, not any particular design. We can apply any that available resources we can utilize, like cloths we can use.
Okay, fine. Thank
Whatever
you.
thing is available, then we can use that in the emergency situation.
Thank you, Shijo, for confirming. Okay.
So the motivation, the aim is that prevent bleeding only.
Yeah.
And while applying the tourniquet, it should not be too tight, and should be prevent.
Yeah, got it. That points I'll be discussing next in slide by slide. But before that, I just wanted to know: do we have a dedicated tourniquets for applying pressure? Is what I need to confirm. That's it. Thank you, Shijo, for confirming. Okay, cool. So, and communication and coordination is also important. Then you might be thinking that it is a serious condition where the patient is bleeding heavily, right? Then how communication plays an important role. That means if you're informing, if you're confirming, if your communication with the EMS team aptly, that then emergency department will make sure that patient is coming to our hospital with so and so condition, so they'll make sure to arrange all the equipments needed in hospital. So it is important to coordinate and communicate the same with emergency department team where you're shifting the patient, okay. And then update the procedures during transportation. During transportation, you might be doing a procedures like tourniquet application, pressure application, IV cannulation, or fluid replacement. Whatever the procedures you have done, that need to be documented, okay. Got it? Why documentation is important? Because it acts as a continuity of care, right? If you are giving IV fluids, if you are done with pressure application, all these things is helps the patient to go for continuity of care. And if there is any legal evidence that all this documentation what we document also acts as legal evidence. Got it? Any doubts still here? Okay, why hemorrhage control is important? Hemorrhage control is critical aspect of emergency medical care, and its importance cannot be overstated for EMTs. That means rapid and effective management of bleeding can be life-saving intervention in many situations. That means as an emergency technician or as a paramedic staff, if I saw a patient with bleeding, before shifting the patient to hospital, first my motto should be how to control the bleeding. And then, as many of you told, fluid replacement, as many of you told, IV cannulation, all this comes secondary. But first thing is how to control the bleeding. If bleeding is very evident, bleeding is very fast or rapid, because if there is a heavy bleeding for the patient will land up into death. This is the primary cause of death. Uncontrolled bleeding is the leading cause of preventable death in trauma situations. EMTs are often the first medical professions on the scene, and their ability to control bleeding promptly can significantly improve patients' outcome. See, first aid. Do you think first aid for patients is important? Yes, right? First aid acts as a prompt response. That means whatever we are giving, that is why CPR is also very important, because we have a golden period for that, right? So we are trying to save the patient by giving basic treatment for the patient, which before shifting the patient to hospital. That is why ambulances and the team who is there in ambulance plays a very important role in saving the life of patients with hemorrhage. Till here, you have any doubts? I will be telling you how to apply direct pressure on the bleeding area, how to apply tourniquet. Okay, all these things I will be explaining you in further slides. Till now, am I clear, or do you have any doubts? Am I clear with this? Okay, I don't have any answer.
Yes, ma'am.
Your silence. Sorry. I will. Oh, thumbs up. I can't see because I am displaying my screen. So I'll be calling few members. Vinod, am I clear, Vinod? Okay. So, and one more thing is, as I just told, the golden hour, the concept of golden hour, excuse me, the concept of golden hour emphasizes the importance of early intervention in trauma cases, which means efficient hemorrhage control within the critical frame can prevent the patient from entering irreversible shock. As I told, if patient is having severe bleeding, patient will land up into hypovolemic shock, for which you guys told the treatment that you will replace with IV fluid administration. But then you guys need to understand, along with this treatment, prevention of hemorrhage is also important. Okay, and preventing hypovolemic shock, also you need to take care of ABC. What is ABC? You might be knowing about BLS and
airway breathing circulation.
Airway breathing circulation. How do you maintain the airway of the patient? Airway breathing circulation. How will you ensure that patient is having proper ABC? Can someone tell me, because this is a basic question or basic thing what AEMT should know, right? In a scene, how do you ensure except supervisor?
You can ask. Supervisor can answer or not?
No. Remaining members. How do you ensure?
Mega Sharma wants to join.
Yeah, Dharmesh, if no one answers, please answer. How do you ensure the patient is having proper ABC, airway breathing and circulation?
When I went to a scene,
Okay.
so पेशेंट से हम नाम पूछेंगे कि हेलो सर आपका नाम क्या है, वो अगर नाम बोलता है दैट मींस एयरवे इज क्लियर.
Yeah, okay.
विद एयरवे इज क्लियर एंड उसका ब्रीथिंग कैसा है वो भी हमें पता चलेगा.
Yeah.
Breathing fast है, shallow है, right? Abdominal movement and accessory muscles are used or not.
Okay.
And with the circulation we can check the check conscious है तो radial pulse check करेंगे, अगर unconscious है तो cardiac pulse check करेंगे, और with the check also the external bleeding is there or not.
Okay, and quick capillary refill test also.
Capillary refill we can, but जो obvious है, जो दिखेगा वो bleeding है, तो ज्यादा bleeding है, that means ज्यादा bleeding है तो patient shock में ही जाएगा. तो capillary refill check करने का मतलब है ही नहीं होगा, क्योंकि वो lazy होगा.
Yes.
Right. So
as Dharmesh told, airway for conscious patients you will be asking questions, but if it is unconscious, patient is unconscious, airway you need to check, is there any visible obstruction? Okay, if there is any tongue backfall, right, that also will lead to airway obstruction. So make sure the patient is having proper airway patency. Patient should have proper airway patency. If patient is conscious, you will be asking patient questions. If patient is unconscious, try to open the patient's mouth. If there is a backfall of tongue, try to check if there is any obstruction externally. If you try to see if there is any obstruction, try to suction that with suction apparatus. This is the basic thing you will do for airway. And breathing, if patient is having, breathing pattern, if it is normal, or patient is having abnormal breathing, that also by assessment you can check. When I'm talking about primary assessment, you should make sure that patient's ABC is clear or not. Okay, without effective circulation, other interventions like airway management and breathing support may not be impactful. Okay, effective circulation should be there. Patient should have proper circulation to maintain airway management and breathing support. And fifth important point is tourniquet application. As Shicho told, how to apply tourniquet in a active bleeding area, right? She is telling that 2 inches above the bleeding area. And here we have pros and cons also, like where to apply tourniquet, where you should not apply tourniquet. If patient is having abdominal bleeding internally, you should not apply tourniquets on joint areas and abdominal. Or if patient is having bleeding on head, there also tourniquet application is not indicated. That I will be telling you in coming slides, where you need to apply tourniquet, where you should not apply tourniquet. Okay, am I too fast? Yes? Am I too fast?
No.
Hello?
No, ma'am.
Okay.
No, ma'am.
Okay, fine. And then you should check for external hemorrhage. How you will be checking external bleeding? You will be seeing, right? If it is having any signs of blood loss, if it is having clear evidence of bleeding, that you will be checking. Okay, visible blood loss and location of bleeding is also important, because as I told, a few areas where you need to apply direct pressure and apply tourniquet on bleeding areas, that you will be identifying, and consider mechanism of injury that may indicate severe bleeding. Okay, here bleeding is also two types: external bleeding and internal bleeding, as I told. Also, you need to assess whether it is arterial bleeding or venous bleeding. But how you will be assessing? If the blood is bright red in color and arterial bleeding, what happens? Blood will be, active bleeding. There is a pool of blood just coming like that, right? If you collect ABG sample, or if you see any patients having arterial line, what is the color of the blood? Or what is the bleeding?
Light red.
These things with the clinical experience only you can tell, right? Yes or no? If you see the difference between arterial and venous blood, you will have an identity of color also, and then you will also understand that arterial bleeding is very rapid, a pool of blood just coming out like that. So you need to identify whether the bleeding is arterial or venous bleeding, and signs of capillary bleeding. That means bleeding will be very slow, steady and flow. It is not like arterial bleeding. Just you all keep this in mind. But in a scene, what happens? Quick assessment and then rapid response to save patient's life is important. Got it? Yes? I'll just show you. Hello? Yes. Okay, I'll just try to show you one video on how to apply tourniquet as confirmed by Shijo. We don't have a dedicated tourniquets to apply pressure. That I'll just go and talk, because we should have a tourniquets which will have a stop band to secure that. If there are no stop bands available, as per criteria, we should not use all these belts or ropes, whatever is available. But try to see this video and then acknowledge if you're having any doubts. Yeah, can you all able to see this?
Yes, ma'am.
Just a minute. See how to stop the bleeding with tourniquet.
मैम कुछ भी नहीं दिख रहा अभी।
मैम आई हैव वन क्वेश्चन.